Because we're at the forefront of cardiovascular care as a group of physicians here at Oklahoma Heart, we felt the need to have this lab so that we could do those cutting-edge procedures for our patients locally rather than having to have them travel to distant centers. Amazing breakthroughs in cardiology and cardiovascular care in the last several years because of advancements in technology. But those breakthroughs are dependent on having high-tech labs like this one. So this laboratory has all the capabilities of an interventional laboratory that an OR wouldn't have, like the X-ray equipment and the special table that allows for use of that X-ray equipment. But it also has the capabilities of an operating room. Its ventilation is fully sterile. It has operating room grade lighting. It has a blood refrigerator. It has enough room for operating room equipment and a heart-lung bypass machine and a perfusion machine to be present in the laboratory because we anticipate and intend on doing procedures that combine the expertise of both those areas. It allows us to collaborate across multiple cardiovascular specialties like interventional cardiology and cardiovascular and thoracic surgery, as well as electrophysiology, and brings us together as a team of physicians to help patients get healthy and to live longer.
Once pacing and defibrillator leads have been in place for more than a year, fibrosis develops, making those leads very difficult to remove. Removal of such leads requires special tools and carries a small risk of life-threatening complications. When these complications occur, they need to be addressed immediately to save the patient's life. The hybrid lab is a cross between an operating room and a cath lab. So you have the advantage of excellent fluoroscopy to assist you in removing these leads, as well as the advantage of having full cardiothoracic surgical backup during these procedures.
These labs are only really available at big tertiary care centers, which have the resources and physicians with the skills to use these type of labs. So we're very fortunate to have this type of lab in Tulsa for our patients.
Not only did Oklahoma Heart Institute invest in this lab, but Oklahoma Heart invested in top-notch cardiologists from major programs around the country. Dr. Mohammed is an outstanding interventional cardiologist that we recruited from the Cleveland Clinic. He has actually done stent valve cases there, and he brings this new technology to Oklahoma Heart Institute. Prior to being at Cleveland Clinic, Dr. Mohammed did his training at Yale University, so he is a very well-trained cardiologist. Dr. Kogert was recruited from the Mayo Clinic to bring the latest in rhythm ablation techniques to Oklahoma, and he is extremely well trained and has already done several large trials now with the rhythm problems and has shown outstanding results. Dr. Kamran was recruited from Texas down at Baylor, and again brought with him expertise in the treatment of some of the atrial fibrillation rhythm problems. He is one of the pioneers in the area of cryoablation. Our cardiovascular surgeons again have been listed in U.S. News and World Report as one of the top 50 cardiovascular programs in the country. They're now able to take their skills and move it into the hybrid lab and do things that normally wouldn't be available in northeastern Oklahoma. So it's a very exciting time.